I'm not supposed to. You know, if I'm not careful, then the wrapper from the sub, the pizza box, I haven't disposed of properly. You got pizza? Yes. It's good. Just saying. Well, if we go into the wonderful world of this stuff, I see. You guys are. If I say something that's inappropriate or you're bothered, just tell me. I'll shut the. You know what up. I'm being very honest with you. I try to. I think humor is important, though this may not be necessary. So if it's not humorous or bothersome, and if it's my opinion, I will let you know my opinion. That's opinion. My wife said, "Are you still using the same stupid jokes that nobody laughs at?" And I said, "Yes, because they have to listen to me." Don't smile. Here we are. Good table. Okay, we're going to look at each of the individuals. We're going to look loose and its role, and we'll summarize the role of each of these. Then we move to dense, and so it's neatly aligned. 3 loose, 3 dense, 3 kinds of cartilage, and finally, and so this is loose tissue, dense tissue. I would frame this as semi-solid, and we get to bone, solid. And there'll be an introduction to bone. We spend a lot of time on bone. I love bone. And so we look at each one of these is going, and it's interesting that the cells are effectively a variation of a stem cell. The fibroblast has the remarkable ability to morph, how or why is unclear, other than chemical signals, into the cartilage precursor with chondro, the prefix for cartilage, or bone, osteo. Bone comes from a cartilaginous shell. Okay, when you repair a bone, it starts with a fracture. They fill the fracture with fibrous and then cartilaginous, and eventually it all becomes bone. So these cells can interchange. That's the remarkable thing about these tissues. That's part of the reparative. They all come from a common stem cell precursor. And I mean, these are the kinds of things that experimentation over time may provide us with better ways to replenish things that weren't there, other than grafting, which has been around for a while. And it's good, but it has limitations. I've done autogenous grafting of bone. In other words, I've taken bone from one place and put it in another place. Because if it's the same person's bone, it's going to take. And by and large, even if it doesn't take, your body breaks it down and eventually replaces it, but it doesn't have a vigorous, nasty reaction to it. The same thing with doing autogenous skin grafts, which I've done years ago, not recently. None of them more recently in 25 years. Okay, and so you're going to see in this, particularly in the loose tissue, you're going to see white blood cells, you're going to see fat cells. The ground substance is soft, gel-like is a good way to describe it, and it's all about the fibers and how they're packed. And we'll either see all of these or combinations of these, or sometimes just a limited number. And you can see the variations. Density is a really good chart. Binding gives it its name. Tension is twisting and bending more than anything else. And yes, your basic water reservoir, salt, mineral reservoir, fat, energy reservoir is found in these tissues that are there. Here, all we've done is we've increased the density. So you're going to see there's a lot more fibers and a lot less space. And here everything changes. You're going to see the ground substance has a different chemical composition. And you're going to see that some of these have elastic, and most of them just have basic collagen. And you really don't see a whole lot else other than combinations of those that are there. And you can see it's got a little bit more semi-solid. Think of it like a gasket. Something you could put down, underneath something heavy to absorb the shock with it. So it resists compression, cushions and support. That's a good way to describe it, I think. And then we'll see bone, which is all about collagen and specific proteins in it. And blood is the connective tissue. Other than you to remember it is fluid in nature. It does, see, there's an error right there. It's got fibers. It doesn't have visible fibers. What makes it fluid is the fibers, which are fibrinogen, are in their precursor state, which is soluble. The whole idea of the clotting cascade is it activates it from the precursor state, which is soluble, to fibrin, which is insoluble, and forms like a net that traps red blood cells and other elements, and the blood clots. That's the ball game. That's the clotting cascade 101. It's the best way for this level is to be comparatively simplistic and talk about maybe some of the more complicated nuances when we get to those in physiology. And then we do some physiology in this class as well. So here they are. All have a common embryonic origin, a stem cell, if you will, from mesenchymal cells, the way you would pronounce it. Okay, varying degrees of vascularity. Bone's got a ton. Cartilage has none. Interestingly enough, when cartilage gets blood in it, it dies. And a lot of the times, that's how bone is made. That's the transition we'll see when we get to how bone works. Basically, it's been invaded by blood vessels. That starts the transition. In most bones, particularly like extremity bones, that whole axial and appendicular thing is going to come back to say hi. And they're suspended in extracellular matrix. And most of these are proteins and such, so they're glycoproteins. Depending on how they're arranged, in some ways they will have the ability to hold on to more water, sometimes less water. I don't know what textbook had the illustration when it was cartilage. It looked almost, when they looked at the molecular structure, almost like a series of bottle brushes that you would use in the chem lab, or test tube brushes. So many of those little, whatever, fibers that protruded, so much surface area, it held on to water. So they were like proteoaminoglycans or glycoproteins, or sugar and proteins. But again, the way the structure of them was very, very unique in making them cartilage, which is very, I'd love to find that illustration. Okay, matrix support cells so they can bear weight, stand tension, and endure abuse. Ground substance varying on its composition, all the way from being, you'd just be having a gel-like, at best, liquid and gel. It has to have some fibers, and it has to have some kind of a cell. The ones we're talking about here all come from that mesenchymal stem cells. Together, when we mix them, by definition, it's called the matrix. Okay? And so and the best analogy I like for, depending on how strong things are, is if you're familiar with what rebar is. Ringing a bell? Okay. It's like, it's when they lay, if you're putting a new sidewalk, okay, or you're putting a new part of the highway that's concrete, you're putting it in with, you're pouring the concrete over wire mesh. It reinforces it. I don't, yes, Dr. Buxton, how it works. Okay, that's kind of what that's how it works. I don't know. We put the periodic table up today. He put it up. I held. Because he knew he was better at doing it. And he's taller. Although he's a Liverpool fan, you can't be perfect. So the ground substance, structure, things can go through it for the most part, depending on how dense it is, you're going to see. Because the denser it is, the harder it is for stuff to flow through it. That means limited blood supply, and that means, I put it this way, it don't heal real good. We used to say in my old neighborhood. So, interstitial fluid, various proteins, things get attached to. Here's those proteoglycans, large sugars, and you hear these terms, chondroitin sulfate and hyaluronic acid. If you, as you get older, depending on who the author is, a lot of us take supplements. Okay, we'll take MSM with chondroitin and hyaluronic acid. You get tablets, go to Costco, get giant jar. Okay, if you have arthritis, theoretically you're ingesting connective tissue and cartilage precursors in the hopes that it will help. And some people it help me, for instance. I mean, does it work for everybody? No. But I mean, so when you see this, these are very significant things. When you see, I don't know if you studied in micro, one of the enzymes, is streptococcus. If you study streptococcus, it makes enzymes that allow it to spread. One of them is hyaluronidase. It breaks apart the connective tissue, and that allows the infection to spread. That's spreading factors. We used to use it because it would break up clots. Before they had more sophisticated agents who bust clots, we used to use streptococcal enzymes and inject those. Just to give you an idea of sort of how this all relates to one another. So water is also trapped in varying amounts, and that how thick or how gel-like it is. Viscosity is always a good word. The fibers, always collagen, strongest, most abundant by far, thickest. A lot of tensile strength, very hard to tear. Those wonderful arrangements of proteins in biochemistry, you should do the fibers and how they're basically you're using spirals that are intertwined, braided. When you braid things biologically, it makes them stronger. When we would do suturing, I did a lot of suturing with monofilament wire. And so what I used to do with monofilament wire, so it's basically stainless steel wire, what they call 3O, which is moderately thick. And I'd take it and fold it in the middle, and my assistant would hold on to one end, and I'd hold on to the other end with a hemostat, and we'd do the twist. We twist it around and braid it, and then I'd use that to secure bones that I'd cut back together. So you're doing what's called internal fixation. And so wire is like that. Why it's so good? Unreactive. I've got wire suture here from abdominal surgery. That's why when I go through hold it, sir. You have any metal in your pockets? And I'm like, metal suture, probably got that. It's like that. You want a funny story about that with the testing? God bless you, Mom. Another good story. Mom was going out to visit her first great grandson. It was the only one she was familiar with when he was born. And they were flying from Rochester, New York down to Charlotte, where her grandson and where the great grandson was. She goes to, and my mom was wearing a pantsuit, except she didn't have a top on under it. She just had a bra on, and that's all. And had an underwear. And she's going through in a wheelchair, God bless her. And the scanner goes off. Ma'am, would you take off? We're going to have to take off that top. She goes, will you take off your top? She goes, I will not. They finally got the message. At that point, an 88-year-old terrorist was in their midst. Truth is stranger than fiction. Elastic are thinner, not super thin, okay? And as you might guess, they stretch. And then reticular, they're collagen, little bit different chemistry, almost a coating. Yeah, they offer more. What they do, they're like a fine mesh. And so effectively they work like a strainer or a sieve. And we'll see them in the medullary canal for almost a sieve with blood elements coming through that. We'll see it particularly in the immune system, in lymph nodes and spleen. That's where you see a lot of what are called reticular connective tissue. And then blast, when you see the term blast, it means busy. B for blast, B for busy. It is basically very, very active, secreting ground substance and fibers. And again, these are they can morph from one to the other, typically in this pattern, from fibro to chondro to osteo. And as you can see, these stem cells within the bone marrow, very, very similar to that, very, very similar in origin. When we say fibrocyte, it indicates they have matured, but if they basically think of matured not being inactive, but no longer being visibly active with making a large amount. It's not their sole purpose. They will do it if they're signaled to do it. And all of these cells are intricate. The difference in epithelial cells, lining cells, are all chained together. Here, what makes it connective tissue, they're connected, but there's a distance between the cells, as you will see. So they're more spread out. That means there's room in between them. The question is, what fills the room really is what their purpose in life is, so to speak. Is this making sense the way I'm explaining it? I'm trying to. So other things that we find in there, fat, you find everything, as you'll see in the first one we look at, loose areolar connective tissue. That's what we have the most of. Underneath every lining cell, under every epithelial cell, is loose areolar connective tissue. It's loose, so remember, epithelial cells are avascular, so it's easy to get circulation. It's easy for oxygen and carbon dioxide to get through. It's very, very well designed in that. So we see fat cells for energy storage, and really this is where when somebody has, like me, gained back, as of this morning, like 18 pounds from my nadir recently, a few years ago, that's where the fat gets stored. And men and women in different locations, but effectively that's where it gets stored. White blood cells, all different types, because your immune system is always ready to go in those areas, and injuries as well. Mast cells, mast cells are really nothing more than a white blood cell that has changed and really play a slightly different role because they have a more vigorous response. They respond particularly with histamine, and histamine has a remarkable capability of dilating blood vessels, changing it, and allowing fluid to extravasate out. Very important in the inflammatory process. And my favorite cells, macrophages, which are monocytes that have morphed into basically, and look, when there's damage, when there's invaders, we immobilize them, we destroy the damage, we fragment it, and macrophages come and gobble it up. They're the big player. Whether it's broken bone, whether it's some damage within the tissue, whether it's underneath the skin, very superficial manner. I want to be a macrophage. Big eater. It's okay. Our dog already has it. So voila. This is classic. This is a good schematic for loose areolar. Everything. The thicker you can see different things. Here you can see, if you look at the way it diagrammed, here's the fibroblast or fibrocyte, depending on the stage. It has tentacle-like projections. You can see the different fibers. You can see the collagen here. You can see the elastic here, the tiny reticular ones, fat cells, a variety of different white blood cells. We'll learn when we get to physiology, we do the blood unit. This is a neutrophil, and here you can basically see over here a macrophage, tentacle-like projections, a lymphocyte here, etc. You can see all of those things, and there's a lot of space. So we're going to look at the categories now. Same one you saw before. It's a series of threes. A lot of things, it's neat, a lot of things are threes. I do a lot of that when I talk about in the physiology. Everybody, I hate that thing when they go, on a scale of 1 to 10, would you grade your pain? We've all been asked that stupid question. From 1 to least painful and 10 to most. I was taught mild, moderate, and severe. You notice they never use the word pain, because pain connotes a problem. They use discomfort. They're taught that. Do you have a lot of discomfort? No, it frickin' hurts. Okay? Discomfort's like you get a wedgie. That's discomfort. That wasn't offensive? No anti-wedgie fans here? You're laughing, I can see that. Same old jokes, shamelessly rehearsed in front of the mirror, every class. The great George Carlin. You know who that he was? The comic? No? Am I so freaking old? He died in 2007. He was the first one to start really being more descriptive in comedy. So, I mean, very interesting if you look at his story. Brilliant. And I mean, I'll stop. We can do him as a project. You can YouTube any one of his comedy specials. They were appointment listening on HBO and things like that. But he rehearsed everything. Sometimes they do, sometimes they're spontaneous. Okay. Train of thought type of stuff. Nevertheless, moving on here, same as what you saw before. So, quotes, proper connective tissue, because effectively it is this gel-like, not solid or semi-solid, are these types. We'll look at each one. Most widely distributed, CT for connective tissue. Areolar means airy. Supports and binds. Universal packing material is a good way to describe it. It's a loose arrangement. It's relatively disorganized. There's lots of space. The problem is that that space allows stuff to go into it. And sometimes when you're injured and you swell, fluid goes in there. So you twist your ankle and you end up with a balloon on your ankle. That is in the loose areolar connective tissue. That's where, as I said, that's where fat accumulates. And it changes that from loose areolar to adipose, the next one of these that we look at. Fatty connective tissue, when it's just filled with fat cells. That's naturally where it goes. Your body has fat all over. You know, they're used for a variety of reasons, mostly for protection and support. This is an area where it accumulates. It's supposed to be there. When it accumulates excessively, it's a problem. Take it from somebody who used to weigh about 280. I've gained and lost people. I was that person. So, loose arrangement, ground substance, water reservoir, macrophages and fat cells. This is what, and if you look at it closely, so here it's under a lining cell. Let's say that was in your bladder, and it's part of that area underneath or around the lamina propria. You can see it a little bit. It's an actual micrograph. Well, I wouldn't put the slide up like this and ask you to identify what it was. I just don't think it's appropriate at this level of education that's there. But some people do. The ground substance in the middle, here are the nuclei. Most of the nuclei here, you're going to see fibroblasts, unless you can specifically see a white blood cell. That's about all there is. There's a lot of space. So everywhere, widely distributed. Underneath all forms that lamina propria, under most mucous membranes, organs, surround capillaries, everywhere. Adipose. So I don't get crazy about white fat and brown fat. We'll stay with white fat, okay? You see brown fat a little bit more in neonates and maybe in utero, eventually as an energy source. It's going to be there. But most of fat is white fat. You'll stain yellow, so we begin to see it. And as you age, sometimes, we'll see people where it's a more yellowish component. So it's areolar. As far as I'm concerned, it's been filled with cells that are storage cells for adipose. It's just what they are. If you can use what they're filled with, and the way I've gained and lost a lot of this has been basically using keto or ketogenic diets. Is effectively what you're doing is you're sparing carbohydrates, your primary energy source, and you're gobbling fats and getting rid of them, and you're inducing your body to undergo something called ketosis. It's been around for a long time. It just got popular when they talked about the ketogenic diet. It doesn't work for everybody. If I could stay away from bread, I would. It's a Stein curse. Bread and cake. Give me liberty or give me bread. So all those things. And what is it? Shock absorption, energy storage. Classic. You see these, and the nucleus inevitably on these, if they picture them, as you can see, is pushed to the side. The problem with that pressure over time, if we see this in the liver, it causes the cells to deteriorate. So when we see fatty deposition in the liver, it's a precursor to cirrhosis. And we see it with, certainly most commonly, alcohol. But you also see it with, viral liver diseases like Hep B, principally Hep C, we see it these days. Other diseases, other toxins that might have been. They're there. But I mean, that's just classic fat tissue. Breast is mostly fatty tissue. The glands really are less notable, not pictured so well here, that are there. They become fatty in nature. And we do this in female reproductive. Enlargement, during lactation is when really we see the glands increase in size. And then lastly, the reticular. Very much like areolar, thinner, okay? And now we kind of changed the name to reticular cells because they basically secrete this variation of collagen. And when they say a mesh-like stroma, it's just that. Spleen, bone marrow, lymph nodes, any place where we're going to almost like sift through materials, just the way we'd use a strainer at home. If you had a bunch of grounds in your coffee and poured it through that, anything like that. As we in cooking call a chinois. It's a fancy French gadget they use in cooking. I watch cooking shows. My presets are like sports channels and I mean, here you can see a little bit of it. You see an abundance, and what you see an abundance of, you see a few of the reticular, but these are white blood cells. You see a ton of lymphocytes in there. Spleen has a couple of functions. If you didn't know it, it has what's called white pulp and red pulp. The white pulp is immunologic. The red pulp is basically sifting through red blood cells, and the ones that are basically have to be recycled. Red blood cells have about a 90 to 120 day lifespan. There. And we recycle, like we do Biol, we're good in that regard. We recycle most of what our red blood cells are. We can recycle the iron, we can recycle, the globins. It's that heme thing that gives us trouble. That's where we get things like bilirubin, urobilinogen. Those are the things that we excrete in urine and feces. And they actually give the characteristic color to urine and feces. We get into that in blood. Dense, regular, easiest to understand. When they talk about the fibers being parallel, we're not in geometry. Not having two parallel lines in a transversal. None of that stuff. We're not doing angle, side, side. It's a joke. Angle, 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 that geometry thing. Think parallel means they're in the same direction, but biological things are wavy in nature, as you'll see. But that's the good news. Tremendous tensile strength, because that waviness allows them to really lengthen and shorten relatively easily when there's tension upon them. Very closely back, they appear white. If you've ever seen in situ, we will see it in a dissection that we do. When we look at the dissection, you can see tendons white and glistening. When you remove the outer layer, it's very distinctive that you can see there. And the structure, when you see somebody like the guy who's pitching for the Padres, tore his quadriceps tendon. The weak point muscle is called the myotendinous junction. When somebody, like what Aaron Rodgers did his Achilles, everyone I've ever seen is the myotendinous junction. That's the structural weak point where muscle gives way to tendon. Not the tendon doesn't tear, it's that junction that separates, with rare exceptions. Very white, very distinctive. And they're wavy, and you can take a piece of tape, and if you cut it on a bias, meaning an angle, you can make it stretch more. If you sew and are familiar with fabrics. My wife is an extraordinarily talented seamstress. Though she made her living making goose clothes. They're cold. Those poor geese. I don't know how they fly with the clothes. What am I talking about? You don't know what I'm talking about. Did you ever see, we use the term empty nesters affectionately. Moms and grandmas whose kids have gone away, and they decorate lawn geese. They're made of either plastic or stone or porcelain. And now they're going to be Labor Day. And they're going to be Halloween, and then they have things. Somebody had to make those clothes, and Patty's Goose Clothes, pretty good business. Now everything's online. Just say it. Have an appreciation for that. That's a good niche. Fibroblasts and they're all collagen fibers. And the difference between a ligament and a tendon is the amount of elasticity. Tendons have a little more elasticity to them. Beg your pardon, ligaments do. There's a little more snap So when you're, and usually it's air pockets when like you crack your knuckles. But ligaments have a little bit more elasticity to them. Very few cells and ground substance. It's nearly all fibers, very little blood supply. It doesn't heal. You can sew them together, it will heal with scar tissue. That's what we used to do before we started grafting for cruciate ligament tears. We used to do all of those things. So it's a different world now. And this is what I mean. They're wavy, but these are parallel bundles. You can see the schematic, very few. This is an example. So you'll look at some of these that are there. Here's a ligament that's between the acromion and the clavicle. This is the acromioclavicular joint that's there. This is here. You can see the capsule, which is made of a different. You're going to see this is dense regular. The capsule is made of dense irregular. That tendon, when you hear about somebody who ruptures a bicep tendon, that's a tendon of the biceps brachialis that's going up here. There's a little groove we're going to identify called the bicipital groove. And what happens is the tendon doesn't rupture per se, it pops out the groove. And it's difficult. It's a little bit, they call it a rupture, but it's not. It's ruptured through what's holding it down to the bone. That's happened to a few football players from the blocking, very predisposed. Aaron Smith, who was on the 05 Steeler championship team, he missed a couple of seasons with those. He's prone to that. So dense irregular, as I was just pointing out, capsules. Organs have thick enclosures. Bone to bone have a joint capsule. The kidney, the liver have capsules that are very, very solid. Okay? Same elements as dense regular, don't heal well, heal with scar tissue, but they're irregularly. They're sheets rather than bundles, is the way they describe it. We find them, the dermis. Your dermis, when we get to skin, the deep dermis is where scars form. When you get a full thickness burn, what they used to call a third-degree burn. And you can use the terms interchangeably for me. That created scar tissue. You understand, when you cut into somebody, you're going to get down and you're going to get through that deep dermis if you're going to do surgery. How many patients said to me, am I going to have a scar? I said, yeah. I mean, I'm cutting into you, I'm going to put stitches, you're going to have a scar. Whether it's a visible scar, whether I construct it in such a way that it's a skin crease so you don't have to see it, that's cosmetic. Now we're doing plastic. You can't magically make a scar without making a scar. Anytime you incise it, even with a stab incision, you're going to have some remnant. Fibrous joint capsules, certain organs. So you see, it's more, you saw the organization before, those wavy lines, not so here, but you can see it's just packed. Withstands tension in many directions. Okay, here's the same illustration. We're just focusing on the capsule. So when we do the joint unit, the capsule is so, we would cut through, and the fibers are very, very well oriented like that. So there's almost a pattern to them that is depicted there fairly well in that illustration. I'd have sometimes my colleagues would take we call a sterile stylus, and they would actually put lines across it and they would make sure when they sewed it back up, you use the lines fit together. You have to do stuff like that. I mean, I was fairly good at being able to see that. If not, it creates something in surgery called dog ear, which means it's like your buttons were cockeyed. You're buttoning something up. And those are somewhat challenging to deal with. And then elastic connect. This is super important. The tissue is not so much reticular and not so much collagen. It's those elastic fibers, big arteries. I can't stress this enough. When you take a look at this, you'll see arteries stretch. It's a rebound. It's like a trampoline. The aorta, subclavians, carotids. The big arteries rely on that to be able to push blood. They rely on this rebound phenomena for like a second wave. It's not just enough to push it out when the heart pumps. By stretching it at the rebound, you'll see, and we'll go over this in cardiac, it closes it closes the semilunar valves. So basically they slam shut, and this wave pushes against those valves, slamming them shut, and just like waves creating an undertow, Like at the ocean, when your feet get filled up with sand, the waves come out, they hit the shore, they push back out. That's how your blood flows. It's a very unique fashion. It's wonderful. You begin to think of the way that the body works, how it creates, rather than we think about a pulse. It's not terribly, the wave, we can feel the pulse. It's not enormous. It's somewhat of a gentle pulse. If it's really pulsatile, that creates turbulence. Turbulence makes blood clots. This is one of these. It's extraordinarily important. You can see, oops, sorry. It's all elastic fibers. You can barely see the layers. They're conductive arteries. The arteries like this are distributing. They distribute it into the various regions. As they get smaller, they change in diameter. We do that in this, probably halfway through this class. I'd say, around break or a little bit after, we'll talk about that. So voila, the aorta, carotids, the subclavians over there, all are characteristic. Helps to make blood flow. You learn something new every day. It's okay. I forgive you from yawning. I have to listen to myself on Wednesdays for 6.5 hours. Someone shoved that a-hole up. I hear the voice in my head. 2 people left. 1 smiled. 2 in the back are just forgetting this. I don't know the names yet. Well, I know we have 2 Avas and a Rachel. Couple of it. Moving. So, cartilage, semi-solid. Okay? Again, why it becomes a chondroblast or an osteo, I can't tell you. There's a chemical signals. It's not clearly understood how those things go on. What's interesting about them, and it's erroneous, it's an artifact. It's something that's there that people have classified, called a lacuna, plural being lacunae. And effectively, what it is, it looks like a hollow, clear area around the cell. So you see this in bone. What happens is chondroblasts are busy secreting a much more solid ground substance, and inevitably it's collagen fibers, and sometimes we'll see some elastic fibers and elastic cartilage, which isn't that common. But mostly it's collagen fiber. And as it secretes that begins to firm up. Okay. When the cell stops secreting, what's immediately around the cell doesn't firm up. So if the cell is here, and it's secreting in all directions. So it's firm in all these directions. When it finally gets a signal or loses the signal to secrete and stops, you'll see a hollow area around it, and the rest is cartilage. That hollow area appears clear. It's because whatever's in there is not staining. Okay, so it's really more of an artifact. It's something that happens because we see a lot of things. We look at skin. So the layer there's a clear layer that occurs in the thick skin. It's clear because it doesn't stain. It's like magically that there's nothing there. In the old days, there's nothing there. No, there's something. So this is what's in there is material that hasn't stained or hasn't had a chance. It's basically, you'll see, but it's characteristic. Very flexible, no nerve fibers, no vascularity, mostly water, collagen fibers for the most part. Here's that chondroitin and that's why people would take it. They hope they're replenishing the joint cartilage for arthritis. Receives its nutrient surrounding bone, surrounding cartilage. Peri means around, is a membrane. Like when your bone heals in a fracture, it heals from the outside mostly, very little with the inside. Same thing with cartilage. And that perichondrium, when it becomes bone, as most cartilage does, your whole skeleton, effectively it morphs into periosteum. So the precursor cells stop being cartilage, they're bone cells. So it gives rise to, now for chondroblasts, and when they stop, they're chondrocytes. So by far and away, all your respiratory, trachea, all the laryngeal cartilages, the cartilage in your nose, all of those, all the joint cartilages, the bones are made out of hyaline cartilage, by far and away the most. Okay, everywhere. Why it's found at the tips, it's what's left. Here's this bone that was all cartilage. When it finally ossifies, turns to bone, what's left are the ends where it forms a joint. It's like a beautiful white glistening substance that's super smooth, and the bones can move on top of one another, not in direct contact. There's a layer of joint fluid. It's called synovial fluid. This I actually know something about. Everybody has their long suit and their shorts. I know a lot about that and useless trivia prior to 1980. The only one who was better getting Final Jeopardy than I was, my mother. Moving on. So, elastic cartilage, 2 places. It's got elastic fibers. Here it is. Boom, your ear and the epiglottis, which is part of respiratory, part that covers the laryngeotracheal area so stuff doesn't get into your lungs ordinarily. And then fibrocartilage, it's mostly hyaline. There's a different kind of a density to it. It's a little thicker. Intervertebral discs, the famous knee cartilage is the menisci. Okay, those are fibrocartilage. Symphysis pubis, which holds the pubic bones together, cartilage it gives. Very, very, very handy for the birth process. Cartilage in your knees, not the only joint with cartilage. Your temporomandibular joint has cartilage. The fact that you can do this, the sternoclavicular joint, you can put your fingers on it when you move your upper extremity, you can feel it up there as it begins to move. Cartilage. The cartilage adds to its ability to move. Same thing with your jaw. It's good news and bad news. Because there's something that, anytime you make something more complicated, more stuff to go wrong. And there it is. Those are the aforementioned lacunae. This is hyaline. Very, very uniform in its appearance. You can't say a lot about it. This is the elastic. Again, that's why I would show this to you. Hyaline would something you could test students on. And now it starts to get complicated. Here's the lacuna. I mean, to me, it's, again, these are more, that clear area is more of an optical illusion to me than anything else. Okay, and here, we can't make anything out of that. That's the fibrocartilage. And interestingly enough, when you have to do, like I had a bucket handle tear years ago of my cartilage. Okay, 40 years ago. I mean, it heals what we call scar cartilage. That's why football players can have multiple knee surgeries and do. Eventually, they're going to need a knee replacement because it heals with scar cartilage, which they can use periods of time. Mark Schlereth, 3-time Super Bowl champ, either twice with Washington, once with Denver, the other way around. I mean, I think he's getting a knee replacement now, probably in his 60s now. Okay, avascular loses the ability to divide as we age, so injuries heal more slowly. Sports injury, and yes, it can become bony. It can morph into bone. And this is a problem. Like the cartilage respiratorily connects your ribs to your sternum, your breastbone. That's why as people get older, they can't expand their chest as much. Harder to breathe, because part of the stretch comes from the cartilage. Just for example. Briefly on bone, osseous, which is the prefix for bone, osseous or osteo, supports and protects. We're going to do a whole unit on bone, reiterate there. More collagen, and what happens, it has proteins in it that attract inorganic calcium salts, mostly calcium phosphate. Some magnesium phosphate, mostly calcium phosphate. The osteoblasts produce, this is a solid matrix, or it becomes matrix, and the same phenomenon we see. When it stops producing, there is an area that appears to be empty. It certainly is not. Little tentacle-like projections of these cells are able to actually go through, and because bone cells communicate to one another. Adjusting, this guy is doing more of this. He's leaning to the right too much. We're going to have to make more bone. We're going to have to take some bone away from here, put it over here. That's how you can tell if someone's right-handed or left-handed, if you look closely at that. So osteocytes stay in there. And again, the cavity, although the cavity makes you think it's empty. Okay, and we'll look at what the osteon is when we study bone. And oh boy, the best thing about bone is it's vascularized. It has a wonderful blood supply. That's why bone heals. I love it. Make sure as long as the blood supply is intact and you keep it from moving around, bone won't heal. And here's what it looks like. This is called cortical bone. This is a long bone, for example, that happens to be the humerus. And you can see it's almost like a series of tree trunks. And here, 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 with concentric rings of this very, very unique material that interestingly goes, and we'll get into it in broad detail. And other than that, just briefly on blood, it's atypical because it's liquid. It's got cells, red cells, white cells, cell fragments, platelets. The fibers, as again, they're in their soluble phase. We have a lot of stuff biologically that is in the inactive phase. Fibers in the blood, fibrinogen, are inactive or else blood wouldn't circulate. Enzymatically, your pancreas makes most of the enzymes that trigger digestion. They don't become activated until they get to the right spot because they're proteolytic, many of them. They gobble up proteins. It's very nonspecific. If someone has pancreatitis, like from excessive alcohol consumption, the pancreas will leak, they get horrible, horrible, horrible pain. The reason is those enzymes are escaping, they'll gobble up any protein. They start gobbling up organs in the abdominal peritoneal cavity. There's not like, oh, we only gobble up stuff we ate. That worked that way. They're indiscriminate. When we get to that area anatomically, I have another interesting anecdote to tell you. And that's all the stuff it does, and we're done. See you Friday. We'll start the skin Friday. I'm sure this is done.